New data from the CDC says almost 60% of Americans have been infected with COVID at some point during this pandemic. What does that mean for society? Sonica Bargo's here with the answer. Sonica.
Alicia, it's actually some good news. UPMC's infectious disease specialist told me this information is a strong sign we're finally shifting out of the pandemic. COVID-19 cases are rising across the country.
We're up as high as 50, 60,000 a day.
So why does Dr. John Goldman say we're reaching the end of the pandemic?
They're still at levels that were much lower than in any other time in the pandemic, with the exception of last summer.
Goldman, an infectious disease specialist at UPMC, says case count isn't the only important number.
We aren't seeing a corresponding increase in hospitalizations.
UPMC is now seeing just 5 to 15 patients hospitalized with COVID, all unvaccinated.
Between vaccination and natural infection, most people have some form of pre-existing immunity.
The spread of COVID-19 has slowed down, but Goldman says keep getting boosters if you're eligible.
It provides protection against breakthrough infection.
That's going to be a regular thing.
I think it's possible we'll get a yearly COVID shot just like we get a yearly flu shot.
Goldman says people still have to consider their individual risk.
I still recommend my patients who are at risk wear masks. Be careful.
But after 2 years of restrictions and surges, most of us can finally start treating COVID-19 a little more like the flu.
Each year we'll probably have fewer cases as more and more people get immune, and there'll be fewer hospitalizations and deaths.
I also asked Dr. Goldman if 2 years is about how long it usually takes to transition out of a pandemic. He told me in 1918, when the Spanish flu hit the U.S., it also took about 2 or 3 years for that disease to fade into the background. In the studio, Sonica Bargo, ABC 27 News.